someone's stuffed up here. Who's at fault?
Oh, look, can I just say, can we have a Be Kind to Receptionist Day today after yesterday?
Yeah.
They were inundated yesterday.
Yep.
They got hammered, and we need to be
Agreed.
kind to them after what happened yesterday.
Okay.
Look, I think to some degree there was possibly a mismatch between communication in terms of that. Essentially, yesterday was an announcement about a website coming up, which isn't just necessarily even a booking service. It's actually a website to direct people. It's a health directory directing patients as to where they can get vaccination, and so directing them to the practices, and it'll be about 4,600 practices as they come on board at about 1,000 a week over the next month, about their how you contact them to make an appointment. And those practices at the moment are individually getting notified or have been notified about the number they're getting, and they're coming to grips at the moment with the clinics that they're going to run, and some of them haven't got to that point of actually working that out. So that there was a bit of a mismatch yesterday, and that's caused a lot of the kerfuffle.
Yeah, but I mean, what are you supposed to do? I mean, I got an email yesterday, Doctor, from my local GP. Obviously, I'm not eligible for a while, but I still got the email, and presumably people who are now eligible got the email as well, and they would have just decided to log in and try and book an appointment. So that's understandable. So where?
Oh yeah, absolutely.
So what needs to happen here going forward?
Yeah, I think the key message now is really about the messaging, actually, about the expectation that this is not a sprint. We need some patience. This is more, look, to some degree, we've had the excitement about this, simmering for a long time, and yesterday it boiled over a bit because of the announcement. Yeah. But the real message has to be for everybody that we have, this is not like the flu shot. There are not 16 million shots out there on day one. At best, we're going to have 1 million a week, and that's going to be staggered in over the next month. Practices are coming to terms with it at the moment, and each of them has only got a small number. And really, this is more like a middle distance race where we have to pace ourselves a bit. We are all going to get our shots. It's not a situation where we need to get on and try to make a booking on day one. So really, it's more about messaging, I think, and that's the main thing that we're asking the government for at this stage.
Speaking of messaging, there's been something of a concerning development in Queensland, where the Queensland government urged people to delay getting their jabs if they have a history of anaphylaxis. The feds then jumped over the top of them to say, no, hang on, there actually is no problem. It's not great leadership up north of the border on this one, is it?
Oh, look, I think we just need to stick with the independent advisors, which is the Therapeutic Goods Administration, and also ATAGI, which is the main vaccination group giving advice on this. It's very difficult when there's varying advice. As you've seen, over the time there's been the query about deaths in Norway of the aged, and then there's the DVT thing based on very low numbers, or the blood clot thing based on very low numbers. And what we need is actually because everybody's anxious at the moment, we're attributing everything to the vaccine at the moment. What we need is a relative level of calm and look at the bigger picture, get some numbers in, and actually be able to give better advice and rely on that. Because I think the thing we've done in Australia is actually done that. We've taken our time to approve these, not like overseas where they had to do it in a really half-baked emergency method. We get the chance to really watch this, and then the same groups are going to be advising, getting the data, and if there's new advice, we should be taking that on board when it comes out.
So just for clarification, if anyone's got a history of anaphylaxis, your response to that, Doctor?
Oh, look, you should still be talking to your doctor about it. And this is why, if next week you're starting and, there's a fair bit of excitement. My wife's clinic is about to start next week, and she's going to be starting next week. So, when you get to that point, you go see your doctor. That's why it's best done by your doctor. Then you can just go through that. If you have a serious allergy, have a chat with them first, and they can walk you through the what you should do.
Hey, our top story this morning, Doctor, is on this stoush that's emerging now between the European Union and the United Kingdom. It's over the rollout of the AstraZeneca jab. The EU says, well, we've been giving you the millions of doses, but we're not getting any in return. So they're threatening to stop the rollout, to stop delivering that vaccine to the United Kingdom because they've got their own factories. What, if any, problem could this mean for Australia?
Oh, look, it has done some harm to the initial rollout because the 250,000 was AstraZeneca shots that we missed out on, has actually affected a little bit of that initial stage before we start making it. So it's actually delayed a little bit, but materially over the long term it won't make a big difference, which is where Australia has been good. We've actually made a priority that we manufacture the vaccine. With regards to what's happened over Europe, I mean, hard not to say it's been a bit of a train wreck in terms of Europe, their management of it. They really didn't get their act sorted out in terms of supporting research, building of factories and stuff earlier on. Then they, have rolled it out very efficiently, and then they make these decisions about, holding back vaccine, and then they make these half-baked recommendations across the country, across various countries about the blood clots, for which it's actually a relatively common condition already. So it's just really been, they've done a lot to undermine the vaccine rollout over there, and possibly a little bit overseas, and it's been really frustrating from Australia to, we've been relatively calm to watch this sort of thing going on over there.
Yeah, and just finally, a closing thought, Doctor, on PNG. Obviously, the government is throwing lots of help and support to PNG. How concerned are you about that?
Oh, very much so. And I think this is where Australians, we're really focused on what happened yesterday and things like that. We need to get a perspective. I mean, this is a worldwide pandemic, and we don't fix this until the rest of the world gets vaccinated as well. And we need to be thinking about what's happening over there, where they're really struggling, but not only just struggling with a very, very limited medical service. So, look, I think we need to be thinking about them, and I've been feeling quite upset about what's happening over there. But I think with regards to, we need to be putting resources in there, but also for all of us, we need to get a perspective about the pandemic. The pandemic is a worldwide pandemic, not just about Australia.
Okay. Dr. Chris Moy from the AMA, appreciate your time as always. Talk to you soon.
It's a pleasure.